I want to touch on Medicaid expansion as well. There was a late push for that expansion. The Senate passed a bill that would have required you to sign us up. House leaders almost instantly were turning their noses up to that, and they removed that provision from a bill that was sent back to the Senate after the passage of the budget on Monday. First of all, did your office have any role in that, or was that strictly House leadership?
Well, I'm going to give you
because you've been against this
I'm
Medicaid
going to give you a long
expansion
answer
from the beginning.
What I've said since the very beginning, and President Obama said this in the very beginning, that in 2000, he said this in 2009, Medicaid is a broken system. Yet what the health care program does with Medicaid is just keeps pouring more and more money in. It doesn't fix the system. That's like continuing to pour more money into a house that's falling down instead of going in and rebuilding the entire thing. So what I have been doing is trying to get some reforms from the Department of HHS in Medicaid, for instance, allowing us to keep our children in the CHIP program is a prime example.
You recently wrote a letter, again, re-urging that.
That's exactly right. And then also looking for other reforms like, a copay, a reasonable, affordable copay for the people who are receiving this. A work search requirement, a job training if you don't have a job, we'll help you do that. We'll work with you. But when you have these mandates in law, what Washington is doing is watching what's going on up here, and all of a sudden the negotiations turned into maybe quietness. I mean, it really handcuffs people who are trying to negotiate. So I've encouraged them, give me the freedom to negotiate. Don't restrict me. And I think that the House agreed with me on that.
Mandates aside and your feelings about Medicaid aside, even the state's own independent fiscal office says this would be good for the economy. It would cover 500,000 Pennsylvanians. What is the downside?
There's big downsides on this. Just look at what was announced yesterday. The administration in Washington is not getting its act together on this. They're delaying, as of yesterday, the requirement that employers would be taxed to the year 2015, which I would note is after the election year of 2014. Yeah, I cannot let the irony go by.
I'm sure that's just a coincidence.
Yes, I'm sure it is too. Right. Okay. But because they're having a hard time getting this put together because it is so complicated. You don't need to make health care that complicated. What were they talking about when they were talking about health care? They were talking about pre-existing condition. Mm-hmm. You could have done one bill on pre-existing condition. Okay, they were talking about portability of your insurance plans. You could have done one bill on that. That's not the case. They have a huge policy. I mean, feet high in the bill of how big the bill is, that they don't know the details into it, and they're having a difficult time getting through it. And the states are having a difficult time getting through it. So I don't know how anybody makes a prediction that, A, the money's going to come in, B, the money's going to be there 3 years from now when this administration in Washington is no longer there, and C, where are we going to get the money in those future years? Right now, in Pennsylvania, 1 in 6 people are on Medicaid. Under the program Washington wants us to adopt, 1 in 4 people will be on Medicaid. Where are we going to get the money to continue to fund that?